Now, vitamin D. Did you know the nation is deficient in vitamin D? If you just walk down the street putting 5 drops of vitamin D in everyone's mouth, you'd improve the health of the country. And why did I say drops in the mouth? Because my colleague, Dr. Sunshine, has shown that millions and millions of Americans do not absorb vitamin D from their gut because of the maldigestion, dysbiosis, enteropathy, etc. So you can give them 50,000 IU of vitamin D, but if it doesn't get absorbed, they'll still be deficient. Under the tongue before swallowing, you absorb through the mucosa. And as you may know, anything you absorb under the tongue goes to the brain first and then the body, and that's a good thing. So vitamin D, we know why it's important. Vitamin D deficiency is related to all of these problems. And we know the goal value, 50 to 80 nanograms. The national average is about 25. The difference in cancer risk between 25, 50, and 75. Okay? If you have less than 25, you have 100-fold cancer risk compared to 75, and about a 50-fold increase compared to 50. So my recommendation is a goal range of 50 to 80. Some other people recommend 60 to 100. Close enough for government work. Say again?
The LCMS.
LCMS.
It's 18 to 72. It's different from the 30 to 100.
LCMS is the most accurate way of measuring vitamin D. That's the method developed by Dr. Mike Hollick. What you're talking about is the statistical range, and I'm saying that is worthless and useless because it's a function of the 50 or so people that they got specimens from to do sensitivity, specificity, and predictive index.
You're saying in which range this is on which test? This is
Well, LCMS, yes. LCMS is the best, most accurate way of doing vitamin D. This is 25-hydroxy-D, not 1 or 125, and 50 to 80 nanograms per ml. The critical thing is nanograms per ml. Some labs reported in international units. You're also asking the question of lab precision, lab quality control. And I'm saying if you look at any range produced by a lab, you get statistical information that has no value in regard to what we're talking about. And the reason it has no value is because it doesn't tell you what to do. I'm saying that whatever value you get, you look at this as your goal value. So let's say the patient comes back at 35. I would increase their vitamin D intake until they're between 50 and 80. Let's say that they come back 120. I would decrease their vitamin D intake until it was back down in the 50 to 80 range. So we don't want too little, we don't want too much, we want just right about everything, especially vitamin D. And regardless of method, this is your goal value. What LCMS gives you is the most accurate vitamin D measurement. Many of the other systems measure things that are not 25-hydroxycholecalciferol. And that's why Mike and others have emphasized, if you want an accurate vitamin D, or most accurate vitamin D, LCMS.
These levels are based on studies that have shown that we need these higher levels. You know, most lab values you're talking about field paradigm are 80% of people fall in the range. That's how we create the range, right?
Right. All lab ranges are statistical artifacts. All lab ranges can be forgotten. Sensitivity, specificity, and predictive index only applies to populations and not to individuals. Galen and Gambino, Beyond Normality, 1976. This is the next generation after that. Predictive biomarkers with goal values and high precision testing so that you can apply it to the individual. Right. So vitamin D, really important for a lot of stuff. Mike Hollick, who we were just talking about, one of his books is The Vitamin D Solution. He happens to be a Boston University guy. I'm glad to tell you he and I went to the same place. But he is our vitamin D expert. Now, you want to take oily fish. You want to take sources of vitamin D in. However, and why? And you want to take them in because if we're concerned about inflammation and high sensitivity CRP or interleukin 10 or insulin resistance, healthy vitamin D intake helps reduce inflammation. It helps reduce insulin resistance. But only when you keep fat to less than 20% of calories. If you have someone with insulin resistance and you want to reverse insulin resistance, you must keep the fat to less than 20% of calories. And as long as you have a whole foods diet without added fat during cooking, you can do that easily. It's not that hard. Getting down to 10% is very hard, and I don't recommend it because of lack of essential fat intake. But a whole foods diet, optimized for immune function, optimized for vitamin D, which is a neurohormone. What does vitamin D do in the body? Vitamin D has two arms and touches cell number 1 and cell number 2 and says to them, stop dividing, we have enough. So yes, it's cancer risk based on the National Cancer Institute's most recent findings, but it's also a neurohormone that tells normal cells, we have enough of you, stop. Well, overgrowth of normal cells is very often observed today, more often than we used to, and it's a direct function of low vitamin D. Who knew? Well, now's the time to know.